Hi, welcome back. Today we are going to see a very high topic. It is about the Nclex medications. Yes, today we are going to see about one important medication, that is Digoxin. Digoxin is also called as Lanoxin. It is under the class cardiac glycoside. We are going to see why it is used. It is used for mainly the heart failure patients, atrial fibrillation, to just control the heart rate. It acts mainly by increase the contractility. So hence it is called the positive inotrope. And it decreases the heart rate by increasing the vagal tone of the heart. So it is a stronger squeeze and slower heart rate. This is the action. And what is the main lab traps we need to encounter is the potassium very low. So there is an increased risk for digoxin toxicity. We have to see the normal potassium value is 3 to 5 millicoulomb per deciliter. So we have to maintain the potassium under this range. If it is too low or too high, there is a very high risk for digoxin toxicity. So the patient on digoxin, where there is an imbalance in the potassium level, we should see for hypokalemia. If it is present, then it is the dangerous sign. So the digoxin therapeutic level here is 0.5 to 2 nanogram per milliliter. So if the therapeutic level reaches 2, it is very toxic, and digoxin has a very short window therapeutic index. So we have to see all these things when we are going to see the digoxin and the lab values. The important antidote for digoxin is DigiFab. It is the digoxin immune fab. When the digoxin is going out, when the range is above 2, if the digoxin level is very high and it is in the toxic range, we use If the digoxin range is very high, it is above 2 nanogram per deciliter, we have to use Digiband. It is a life-saving drug, mainly for life-threatening dysarrhythmias because of the overuse of digoxin and to treat the severe toxicity because of digoxin. The drug interactions here is the loop diuretics. It has a example Lasix. This can cause low potassium level, so hence the toxicity of digoxin is increased. And the other drugs which interact are amiodarone and vermapril, where it causes the increased digoxin levels. And even the antacid also causes the increased digoxin levels. When we are consuming fiber more, this causes the decreased absorption. So we have to be very cautious when consuming the fibers. The important takeaway message, what we have to teach patients is, we have to tell them to take the pulse daily. And if there is any abnormal signs of nausea or vision changes like green, yellow halos, have to be immediately reported. When you are missing the dose, please don't double dose the tablet. Always we have to maintain the potassium intake appropriately unless it is contraindicated. So the pulse has to be taken. It is always the apical pulse. It is not the radial pulse. It is a trap. So this is about the digoxin. I hope this topic has given you a good adequate knowledge regarding the medication digoxin, which is a cardiac medication. Thank you and happy learning.